So Jason, where are we with clinical efforts right now? And if you can share, where are we with commercial efforts?
Yeah, we've got a couple really exciting clinical trials in process right now. And one of those we will use to apply to the FDA for approval for our FFRCT solution based on the morphology in the vessel wall. So getting at the true source of whether or not that artery can dilate or not. And then, an event prediction study as well is running in parallel to that. So we expect to, with this next round of funding, move forward with a couple of other really exciting ideas looking at the ability to predict major adverse cardiac events based on plaque quantitation from our methods, and then steer interventional or therapeutic treatments for those patients that we know are at risk of an event. So we expect to, in the not too distant future, come out with a combo product where we would be able to deliver a high-risk plaque phenotype at the same time as we're delivering an ischemic plaque phenotype. Is that lesion causing a flow restriction, and at the same time, is that lesion causing an acute event or at risk of causing an acute event? And so we will commercialize that next year. And the target audience will be cardiologists, interventional cardiologists, radiologists that are taking care of patients. And because we can do this two ways, we can do the analysis for you. If you don't have the staff, you can, if you have the staff and you want to do this locally deployed because you want to see the inputs and you want to understand yourself based on an expert analysis of the CTA, an expert analysis of the output of our technology, you'll be able to do that on site as well. So we think that's a real advantage. There are lots of centers throughout the world, whole entire countries that can't send their images off site. So they need to have the ability to do the local deployment, the local analysis to make decisions for their patients. It's a faster way to get results for your patients. So, potential deployment in the emergency room if someone's having chest pain, where CTA is prevalent and used to rule in or rule out patients with suspected coronary disease and chest pain. So the flexibility of our deployment and the rendering of a report in the EMR, the ability to pull that report up in the physician's office and see that not only helps you predict risk and determine the clinical pathway. If you determine that the clinical pathway is an interventional therapy, the ability to plan that based on having the full morphology of the area that you're going to go in and treat. Is it heavily calcified? What's the arc of the calcium? Is it a big lipid pool? Do I need to protect the distal bed with a distal protection device to prevent a paraprocedural event or something like that? So really from the continuum of care of atherosclerosis, the atherosclerosis process, right? Suspected coronary disease, way upstream, early detection down to, okay, this patient needs an intervention. What's the best pathway here? What's the most efficient pathway? What's the right wire I start with? What's the right stent, right? Does this patient need atherectomy, right? So rather than having, 30 wires and 20 balloons on the back table, sometimes that happens. And you got blood all over the floor, right? You can plan all that in the physician's office with a planning software that looks, it's not a fabrication, it's not a rendering, it's the actual patient's arteries and the flow and what's in the wall. So from end to end, personalizing the decision in the clinical pathway.
Absolutely. So we have a current FDA-cleared platform that is characterizing tissue in a manner that emulates what a pathologist would do if they had that under a microscope. So enabling physicians to better assess a patient's risk of event, plan for procedures, and then monitor how a patient's responding to treatment. This next iteration of the platform that Jason spoke to, we're very, very excited about, and we'll take our current clinical users to the next level, but also expand our market significantly.